I'm a psychologist working at Pediatric Psychology Associates.
I'm a therapist, a PPA.
I am a licensed psychologist, and I'm also a board-certified behavior analyst.
I am a psychologist.
I'm a child and family psychologist.
I'm one of the therapists at Pediatric Psychology Associates.
Hi, my name is Dr. Bridget Davidson. I'm a psychologist working at Pediatric Psychology Associates. So in terms of my training, I went to the University of Miami where I received my bachelor's degree in psychology and studio art. I then went on to the University of Texas at Austin, where I earned my master's degree and my PhD in clinical psychology. I then came back to the University of Miami for my internship at the Mailman Center for Child Development. I also did my postdoctoral fellowship there. So my area of specialization is working with individuals with autism spectrum disorder and also working with very young children who may have developmental delays, developmental disabilities, or social communication challenges, as well as disruptive behaviors. I also specialize in parent coaching to address those things. So in terms of a typical day for me, typically I do evaluations, so assessments with children in the mornings. In the midday, I usually work on notes or report writing, and then in the afternoons, I usually spend my time doing therapy sessions.
Hi, my name is Dr. Roseanne Lisac. I am a licensed psychologist, and I'm also a board-certified behavior analyst. So if you've ever heard of anyone doing ABA therapy or applied behavior analysis, I do that as well. I have been working in the field for over 10 years across the autism field, the typically developing field, and went to UCLA, University of California, Los Angeles for my undergraduate. I then went to Fordham University for my PhD in school psychology, and then ended up specializing in autism and behavioral interventions for my internship and for my postdoc, and then actually sub-specialized in pediatric feeding disorders, so using behavioral interventions to address feeding concerns in super picky eaters. So not anorexia or bulimia, but rather kids who don't eat enough food or are on feeding tubes and need to relearn how to eat. So I was the director of a multidisciplinary feeding disorders clinic where we had speech language pathology and nutrition, and then I worked from the behavioral side to reteach the behaviors since it's sort of more like a phobia, and did a lot of habituation training and exposure and response prevention with regards to the interventions. So that's my specialty, but I also do a lot now of parenting with regards to anything having to do mostly with kids 8 and below. So a lot of times it's really working with parents to figure out how to best help support their children at home, and working with parents to think about how to add new tools into their toolbox. So I work a lot with parents. I'm also trained in PCIT, parent-child interaction therapy. So for children who are having a lot of problem behaviors, again, working with parents and coaching them in vivo, oftentimes through a one-way mirror, and helping them learn how to, number one, reintegrate and play with their children appropriately, but then also how to respond consistently to problem behavior that arises. And that's what I do. And in my daily life, I am part-time in private practice. And then the other time I'm also working as a program coordinator for an online master's program in ABA. So I teach courses and I'm in charge of practicum placement for those programs. So my day can consist, especially now with COVID, anything from teaching online classes to jumping onto telehealth with families to helping my own kids navigate their Zoom experiences at school. So it's been a wild ride this past few months, but generally I'm usually juggling a few different balls in the air. And right now I'm doing the same, but really enjoy the experience of teaching and training while also doing therapy and direct clinical care.
Hi, my name's Isabel Hernandez. I'm a therapist at PPA. I've been a therapist for about 2 years. And so before becoming a therapist, I went to school at FIU and I got my bachelor's degree in psychology from there. And then I went back to FIU and I got my master's degree in clinical mental health counseling. In my work as a therapist, I enjoy working with kids, teens, and young adults to help them with a variety of issues like anxiety, transitions, difficult behaviors, impulse control, and being able to develop and maintain successful relationships. So in a typical day, I'll go into the office and I'll work with my patients either in person or through telehealth, and we'll practice social skills and social understanding, coping skills to manage difficult situations, being able to cope with anxiety, and being able to communicate effectively with others.
Hi, my name is Amrita Singh. I am a psychologist. I've been a psychologist since around 2015. I got my bachelor's degree from the University of Miami and my doctoral degree in clinical psychology from Nova Southeastern University. My specialty areas are the treatment and assessment of autism spectrum disorder, as well as a range of anxiety disorders. My typical day is pretty busy. I do a mix of evaluations, therapy, and supervision. So I typically do evaluations for autism spectrum disorder, intellectual disabilities, and other developmental delays. I supervise doctoral students on their assessments as well as their clinical writing skills. And I provide individual therapy to children, adolescents, and young adults who are presenting with a range of symptoms that could be related to anxiety, OCD, or autism spectrum disorder. I really enjoy having variety in my daily schedule, which is why I have that blend. And that's one of the really nice benefits of being a psychologist.
Hello, my name is Dr. Samantha Crella, and I'm a child and family psychologist. I love what I do, and I'm here to tell you a little bit about it. In order to become a psychologist, you have to go to college for a long time, but it's not that hard if you dedicate yourself. So I went to college for 8 years. The first 4 years was my associate's degree and bachelor's degree, and the next 4 years was a master's degree and a doctorate degree. The good news is after you go to school for 4 years, you can start to work in the field and provide counseling to people. I love what I do. I love talking to people, especially to kids and teens just like you. Some of the things that we talk about are stressors that kids have with school, with their friends, and with their family. Some kids deal with anxiety and depression. Their parents might be going through a divorce. They may be having a relationship problem. They may have some school learning things that they need help with, but we help and work together by solving problems and making things better. I also talk with kids and teens about their goals and their future. And so I get to know many of the patients that I see and help them and be a part of their life, which I really enjoy. So if this is something you like to do in talking and helping people with their problems, then being a psychologist or a therapist is right for you.
Hi everyone, my name is Ashley Ratzlaff and I am one of the therapists at Pediatric Psychology Associates. I actually work as a registered mental health counseling intern, which means that I'm working towards licensure as a mental health counselor, and I work under the supervision of several licensed psychologists at PPA. I actually graduated this past December from Florida International University in counselor education. So I've been working at PPA for just under a year. I started there in January of this year. In my undergrad, I majored in psychology from Tulane University in New Orleans. And basically what I do at PPA is right now I mostly see individual clients. So either at home right now, just with everything going on through telehealth, or also in the office. In the past, I have also worked and helped out with some of the social skills groups at PPA, where basically we're helping kids and teens, practice different social skills, social understanding, interacting with other kids, but in a fun, structured environment. One of the other things that I do for PPA that's pretty interesting, and one of my specialties, is that we actually partner with a local neurologist and see her patients who have chronic migraines. So we do consultations with her patients, and then we also offer a specific therapy called CBT for migraines. Where we teach coping skills to help people with chronic migraines manage the pain and often the stress and anxiety that comes along with having a chronic pain condition. So I would say like my areas of specialty, or the areas that I really prefer, I definitely like working with younger kids, elementary school age, like probably 12 or younger. I love the challenge and the creativity that comes along with keeping kids engaged in their sessions, trying to keep it fun and interesting, while also working under a evidence-based model of therapy and treatment. But also, I do work with some teens, some middle and high school aged teens. Like I said, I do the CBT, or coping skills for chronic pain management. But my other areas that I really prefer are anxiety and stress management, and also just that social understanding, emotion regulation, and frustration tolerance, especially in younger kids. So that also comes along with a lot of parent education, and helping to incorporate some strategies at home that could help the child then be successful in the home and school and with their friends.